Hello friends, welcome to another lecture of Alaa notes. This is page number 8 of the Alaa notes, and the question says woman had adhesions in pelvis and peritoneum and signs of obstruction. What is the organism? So the question is telling you about the pelvic inflammatory disease, and the most common organism here is chlamydia, and the recommended treatment for chlamydia is erythro and doxycycline. So the other question asked about patient with history of pelvic inflammatory disease, pelvic infection, and treated for it is now coming in the clinic because of infertility. So there is history of PID, then you automatically have to suspect that there could be obstructions or adhesions. So there is also the history of infertility, then this make us our diagnosis even more stronger that there could be obstruction or adhesion in the tube. Despite regular sexual activity, what investigation will you do? You have to do hysterosalpingography to look for adhesions. So uh, other question is patient came with feature of pelvic inflammatory disease. What is an investigation? Same here, hysterosalpingogram. So this is a different question. Which bacterial infection is associated with intrauterine fertility device in PID? This is very important, and you have to remember actinomyces. Actinomyces israeli is associated with the pelvic inflammatory disease associated related to intrauterine device. So most common cause of ectopic pregnancy, no history of anything was given in the question. So the most common cause is ectopic pregnancy. Now here you have to remember these 2 points. If they ask you about most common risk factor, then it would be pelvic inflammatory disease. But if they ask you about most significant, then it is previous ectopic pregnancy, because if there is a previous ectopic pregnancy, then there could be another chance that there will be another ectopic pregnancy as well. So couple uses condom, which type of infection? I don't know what was the question, they didn't mention the question clearly. So pelvic inflammatory disease is the answer here. Now we are discussing page 9 of the Alaa notes. The question says chlamydia infection plus pregnant woman. What is the commonly infected part of the neonate? Now here the terminology is changed. Which of the following part of the neonate is most commonly infected? And it is eyes, because the chlamydia causes trachoma in the neonate, and it is the most common cause of blindness overall in the world. So strawberry cervix with yellow to gray discharge. So here there are two clues: strawberry cervix and yellow and gray discharge, and they also mention flagellated bacteria. Then it is not chlamydia. Chlamydia is not there. Then you would suspect trichomonas vaginalis, and the treatment is metronidazole, or the other is Gardnerella. Gardnerella. So the treatment for this is also metronidazole. So which vaginal infection is diagnosed? I don't know what was the question. They simply asked candida, so they must have given the white color vaginal discharge or diabetic patient or something like that, which leads to the diagnosis of candidiasis. So the question asks pelvic adhesions caused by, so pelvic inflammatory disease is caused by chlamydia, as I have told you earlier. A case of 20-year-old with gestational trophoblastic disease, I assume this is GTD. Grossly abnormal mass on cervical examination, then it is for sure gestational trophoblastic disease or molar pregnancy with hemoptysis. What is the next step in management? Admit for the staging of the disease. This is very important. If they mention you this GTD, gestational trophoblastic disease, then you have to do the staging for proper management. So vaginal discharge under microscope, they show flagellated bacteria, then this is trichomoniasis. So the organism is Trichomonas vaginalis. So yellow green discharge, the organism is trichomoniasis. So here you must remember the types of vaginal discharge. This is very important, because if there is white color discharge, then it is candidiasis. If there is grayish color discharge, then the answer is gardnerella. And if there is yellow green discharge and flagellated bacteria, then the answer is trichomoniasis or bacterial vaginosis. So vaginal discharge pseudo hyphae. Now here pseudo hyphae is seen in fungal infection. Then we will go for candida, and the treatment of candida is fluconazole, itraconazole, etc. A woman with smelly, this is not smiley, this is smelly vaginal discharge and itching. Her husband has history of urethral discharge. Now here this is important. Both of the couple, male and female, has UTI, STD. So if both of them had STD, then it is high chances of gonorrhea. So you have to give ceftriaxone to both of them, because in gonorrhea you have to treat the both. Woman went to pregnant clinic in woman want to get pregnant in winter. What to give her before pregnancy? This is very important. You have to give influenza vaccine, because you want to get pregnant in winter to prevent from influenza virus. So want to get pregnant depends on if there is less than 1 month, so you have to give influenza vaccine. If she wants to get vaccinated before pregnancy, then you have to give rubella. You would never ever give rubella vaccine during pregnancy. Okay, so influenza during pregnancy, so rubella before conception. So this is the clue. Contraindicated vaccination, as I have said, rubella vaccine is contraindicated in pregnancy. So female, her previous pregnancy is stillbirth, and now she want to get pregnant and ask the doctor about all the vaccine that she is needed before conception to reduce stillbirth. So here the rubella is answered, because due to rubella there are increased chances of preterm birth, or there are increased chances of stillbirth due to the rubella infection. So vaginal infection can cause incompetency. So the right question would be, which vaginal infection can cause incompetency? The right answer is bacterial vaginitis. So what vaginal infection cause incompetency? Same, the answer is bacterial vaginitis.